my name is Brian. I am an N3 student, and today I'm going to be performing the lipid and TPN administration. Okay, so for TPN, it's typically required that it's recommended for patients who are unable to, absorb nutrients properly. This is because they have like an alteration to their gastrointestinal tract, or they're getting GI resectioning, and they can't absorb the nutrients appropriately. And TPN is also given for patients who are severely malnourished. And to keep in mind with TPN administration is the patient's blood glucose levels will fluctuate during the therapy of TPN. We need to assess their blood glucose levels using a glucometer, and we need to correct any high levels of blood glucose using insulin sliding scale via doctor's orders. We also need to keep in mind the certain patient electrolytes that are going to fluctuate because of the certain additives that are going to be mixed into the TPN solution. An example is the patient's getting a lot of potassium mixture in it, and we have to assess the patient's potassium level. We also need to assess for certain complications that could happen, such as sepsis. And we also need to perform daily weights to obtain the patient's baseline weight and assess how well they are tolerating TPN administration by looking at the fluid intake, because that's really weight is a good indicator on assessing how much fluid they've taken in. Another great indicator is performing strict I's and O's on the patient during administration. We also need to assess the patient's renal function to make sure they're able to process the TPN solutions correctly. We can do this by looking at the patient's BUN level and the creatinine levels. We also need to assess any liver labs or lipid labs, because you're going to get lipid administration, and lipids, their lipid levels will fluctuate as well. So we need to assess those labs as well. Certain labs are like ALT, AST. Okay, so now I'm going to go ahead and perform the procedure. As you know, I've been showing you my equipment right here. So for the scale, I will need my equipment. It's going to be my TPN, my lipids, the glucometer. A scale is preferred. I could use a patient's bed scale. Tubing with a special 0.2 micron filter. This is in reference to the book, my skills book. It recommends using a 0.2 micron filter for TPN solutions that are not mixed with lipids. I also need to have my gloves, my D10, and my tubing, and I believe my alcohol prep pads for accessing my patient's central venous access device. So before I begin, I need to verify my doctor's order, make sure my patient is receiving TPN solution, and I need to wait for pharmacy to deliver my lipids and TPN solution. I need to wait a good 30 minutes to an hour, make sure they're not cold, and make sure they are in room temperature. During this time, I should also assess my lipids for any separation of emulsion layers, fat globules, or accumulation of any frothiness. And because that indicates it's not good, and I need to send it back to pharmacy. Same thing for my TPN solution. I need to verify for any layering or turbidity or precipitates, because that can indicate that the bag is no good and bacteria has gotten in it, and I need to send it back to pharmacy to get a new one. I also need to check my TPN solution and verify that the solution and additives match the doctor's orders. And before I leave the room, I want to grab all my equipment, my special tubing, and I want to grab these papers right here, which are labels for my solutions. These labels tell the patients. These labels have the patient's name on it, the room number, the date and time, the flow rate that's prescribed to them, the bottle numbers, the medical record numbers, and the start and stop times of the solutions. And before I leave the room, I also need to verify with another nurse using a second nurse protocol, and walk into my patient's room and clear the table, clean it, and identify myself and what I am going to do. So Hi, my name is Brian. I'm going to be your nurse for today. And today I'm just going to be giving you some TPN and lipids. Before I begin, let me go ahead and hand hygiene and provide privacy. And can I go ahead and see your ID band? I'm going to verify that his birth is correct, his date of birth is correct, and his patient and the patient's name. I gotta ask him, can you tell me your name? Can you tell me your date of birth? Do you have any allergies? I can make sure everything's correct. Okay, once I finish assessing that, I have the right patient. I now need to explain the procedure to him. I'm going to just explain that, so TPNs, I am going to be giving you TPN and lipids. This is because right now you are not absorbing your nutrients well because you are having some GI issues or a gastrointestinal issue. The issue is that it's not working right now and you're not absorbing nutrients. So we need to administer these TPN solution and lipid solution into your central access device, and that's going to help you get the nutrients you need. Do you have any questions? Do you need to go to the bathroom before we begin? Okay, no? Okay, great. So, and before I begin, I want to get a set of vital signs just to get like a baseline of his vitals. This is going to be helpful because I'm going to be needing this in case, complications arise, like an adverse reactions to the lipids or, sepsis. So I need to get like blood pressure, heart rate, respirations, temperature, and all that. And, again, assess my patient's weight before I begin. Okay, so after I'm done grabbing all my pre-checks, I want to, hand hygiene, put on gloves, and I want to assess my patient's central access device. His site, I want to assess the site for, any infiltration, which is indicated by, pain at the site or, leakage at the site. I also need to assess for any infection, which is seen by a rise in temperature or any chills in my patient. After I'm done assessing the site, I need to assess for the patency of the IV, the central venous access device. I could do that. I can check patency using the facility protocol. After I'm done assessing the central access device and checking for patency, I am now going to go ahead and remove my gloves, hand hygiene again, put on new gloves, and prep my my solutions. So I'm going to use a special inline filter with my TPNs, and I want to prime that. And same thing with my lipids. I want to hang that, prime it, hang my D10 and prime it, just in case. The D10 is used for in case the TPN solution is stopped intermittently and it's there to not cause any catabolic state for them, and a decrease in hypoglycemia or hyperglycemia can happen. So that D10 is there just in case that waiting period between a new TPN solution and an old TPN solution. Okay, so after that, I want to make sure my TPN solution gets its own pump and my lipid solution gets its own pump as well. I also want to make sure the TPN solution, the filter is above the TPN line because if the filter, was below, or if the TPN line or the lipid line was to encounter the filter, it's going to cause coagulation, and that's not good. So we want the filter, above it or separate from the lipid line. So I want to designate each solution to a pump, and connect it to the Y tubing, and connect it to the central access device. And then I want to do my checks with the doctor's order and prescribe the proper flow rates to each pump. So after I do that, I believe that the TPN and lipid administration is, up and running. So lastly, I want to do is, do my checks after, I have the TPN solution up and running. I did my checks. I want to make sure I change the like the filter, the IV lines every 24 hours. Change the tubing and solution every 24 hours. Um, I also want to, thoroughly clean the port according to protocol, like the central venous access device. I want to label my tubing as well with date time initials and date time of usage and my initials. I also want to make sure I'm not, doing any blood drawing samples or infusing any other fluids with my TPN line. So I could just go ahead and just let me flip this over. I just could go ahead and make sure I'm not again drawing blood samples with with my central venous axis with my designated line that's getting the TPN. I also want to assess for any complications with TPN administration. Again, this is using a central access device, so complications are going to be severe. The complications I want to look out for is going to be, sepsis. So, a sign of sepsis is decrease in blood pressure and elevation in respirations and heart rate. So that's why I got the baseline vitals before I started. And other complications include an air embolism. With an air embolism, I need to assess for shortness of breath, any dyspnea. I also need to assess alterations in my patient's blood glucose. There could be a hyperglycemia, which I believe a sign is thirst and polyuria. Hypoglycemia as well. Signs are diaphoresis or shakiness, osmotic diuresis. So what's important for osmotic diuresis is the keeping strict I's and O's, because that's going to assess for osmotic diuresis. We don't want to see an increase of output in my patient, because that's indicative of osmotic diuresis, and that could lead to seizures or a coma. We also need to assess for infiltration, which is again leakage or pain around the site. Infection as well, which is signs of an increase in temperature or erythema around the site, the central venous access device. I believe after the administration is up and running, after I set it up and running, I will now need to remove my gloves, hand hygiene, and ask the patient how well he's tolerating the procedure. Keep an eye on the vitals for the first 15 minutes. Make sure there's no adverse reactions with the lipids. After that is complete, I want to put my patient's bed down, put the rails up, hand hygiene once again, and assess the labs I mentioned in the beginning, assess the vitals periodically, assess for the potential complications I verbalized, assess for the blood glucose readings, depending on physician's order, or generally every 4 hours. And after that, I want to document what I performed, and I believe that is it. Skill is complete. Thank you.